Just with being a diabetic, there is the side effects that you can possibly lose eyesight and kidney problems and things. So from that point of view, your blood sugars being well controlled before you get pregnant and during your pregnancy, you're looking after your own health as well as the baby's health.
You can have a much bigger baby if you don't manage your diabetes because it's getting a lot more sugar than it needs.
I am aware that if your blood sugars run a little bit higher, that you can risk having a larger baby, which can then become more difficult when it comes to birth.
I don't think I've had any more difficulties or concerns than any woman who's going through pregnancy who worries about everything that happens. I think the concern initially of having a high blood sugar was difficult because you did worry that miscarriage and other things were higher if the control wasn't good. But as I got further through the pregnancy, I think you just get used to it, and it becomes the diabetes itself doesn't become an additional concern.
The consultant advised me that poor blood sugar control could lead to a really large baby and other complications, but I don't really know what the other complications are.
It's true that having diabetes means that you and your baby have a greater chance of serious health problems. You may be at risk of having a large baby, for instance, which means that you are more likely to have your labour induced or need a caesarean section. You also have a higher risk of miscarriage, and there is a possibility you may develop problems with your eyes or your kidneys. Your baby also has a higher chance of not developing normally and having health problems following birth. However, if you look after yourself, these risks can be greatly reduced, and almost all women with diabetes can have healthy pregnancies and healthy babies. So, tight blood glucose control before and during pregnancy, together with regular contact with your GP and diabetes support team, are absolutely essential.
You need to plan it, and if you ever want to have a baby, you have to go to the doctor, you have to go to the hospital and tell them that you're planning for a pregnancy.
I only have information about pregnancy and diabetes through the diabetes team, so also went online to find out information too. But
My main lifestyle change before pregnancy was just to check my blood sugar a lot more often. When I was younger, I found it difficult when I was at college and working to be checking my blood 4 or 5 times a day, but for the last year I have started to take a lot more interest in it, and it's given me a clearer picture of where I'm sitting at with my blood sugar.
Before you stop using contraception, there are several things you can do to get your pregnancy off to a healthy start. In fact, just as there are 9 months in a pregnancy, there are 9 simple steps to prepare for that pregnancy, so it's easy to remember. Here's the lowdown on each one. Step 1. See your GP. Pregnancy advice may not come to you, so it's vital you approach your GP and your diabetes team. They'll be able to advise and help you with each step. Believe it or not, even what you do months before conception will help you and your baby in the long run. Step 2. Control your blood glucose. Ideally, your blood glucose level should be between 3.5 and 5.9 millimoles per litre before meals and below 7.8 millimoles per litre 1 hour after eating. You'll be able to agree your own ideal level with your team. You also need to make sure you have a kit for testing your own blood glucose levels. You should also have an HbA1c test. This tells you how good your blood glucose levels have been over the past 2 to 3 months. Before becoming pregnant, you should aim for as low a score as possible, ideally below 6.1%. Remember, any decrease in blood glucose levels will reduce the risks for you and your baby. Step 3. Check your medication. Some medicines used for high blood pressure or to lower cholesterol may not be safe for use in pregnancy and may need to be changed. Step 4. Start insulin injections. If you have type 2 diabetes and are planning to become pregnant, you may need to change from tablets to injections of insulin. Step 5. Check your insulin. Some insulins may not be suitable for use in pregnancy, so you'll need to discuss this with your diabetes team. Step 6. Take folic acid tablets. Folic acid is needed to help the spinal cord develop properly and prevent things like spina bifida. It's important to take regular folic acid tablets at least 3 months before trying to become pregnant, and for the first 3 months of pregnancy. For women with diabetes, doctors recommend a 5 mg dose. That's much higher than is available over the counter in a pharmacy, so you will need a prescription. Step 7. Have your eyes and kidneys checked. Pregnancy can create extra pressure on the small vessels in your eyes and kidneys. So it's important to get a health check and treat any problems that are identified before becoming pregnant. Step 8. Look at your lifestyle. A healthy lifestyle is vital for all women planning a pregnancy. Not only will it keep you fit and well, but it ensures your baby gets the best possible start. That means a healthy diet, regular physical activity, keeping your weight at a healthy level, and, if needed, losing weight. Have a chat with your diabetes team about your diet and about what kind of activity suits you best. Swimming, walking, stretching and low-impact aerobics are great if you're just starting a fitness program and can usually be continued throughout pregnancy. It's no secret that smoking and drinking can harm unborn babies, so wanting to protect your baby is as good a reason to give up as there could be. If you're finding it hard to quit, don't forget your diabetes team is there to help. They can advise you on all your options and recommend the best ways to manage your cravings. Step 9. Finally, make sure you're immunised against rubella. This will protect your unborn baby in the event of you coming in contact with German measles.
I'm not sure that diabetic women are aware of the associated risks with the pregnancy. I feel it's something that consultants should be discussing as soon as someone is sexually active. I know it's a very personal question, but in the end of the day, you are talking about the possibility of another life and being responsible for that life for 9 months. So I do believe that people should be more open about talking about it, because really prevention of an unplanned pregnancy is better than possibly dealing with the consequences of risks along the way during a pregnancy.
Your exercise, your salt intake, you're keeping your blood sugar levels within the right ranges. So there's a lot you can do. You can be quite proactive about it. If you want to have a child, there's no reason why you can't have a healthy child.
For women with diabetes, taking control of your life might mean a little more work, but it can make the world of difference. This is one area where knowledge really is power, hence the reason for this DVD. If a baby is the last thing on your mind, make sure you have the right contraception. If you're planning on getting pregnant, then follow the 9 simple steps we've laid out on the DVD. Excellent blood sugar control and a healthy diet and lifestyle are also vital. And remember, you're never alone. All the way through, you'll enjoy the support and advice of your GP and dedicated diabetes team, so don't be shy about getting in contact if you have any concerns or questions. Finally, if you are planning on pregnancy, remember that there's no reason that women with diabetes shouldn't have a healthy baby.